I'm Rachel Goldberg. I'm Director of Health and Aging Policy for B'nai B'rith International, and we're involved in a number of issues having to do with the budget, healthcare, and aging issues in the United States. And we got involved in these for a number of reasons, but mostly because they affect almost all American families in one way or another, and particularly those who have aging grandparents or parents. And we are particularly interested in some of the things going on with the budget this year. And we do think that they're important for older adults, but they're also important for people who have relatives and friends who are older, and for people who are planning on getting older themselves, so that pretty much counts all of us in that group. And today I want to talk a little bit about something you may be hearing about called the chain CPI, which has come up in the President's budget, but it's also come up in a lot of the negotiations that have gone on for the last couple of years about the budget. And it's something that a lot of people have heard about but don't really know what it is. And it's something that would affect not just older adults today, people who are on Social Security, but also people who collect Social Security right now who are not older adults. One of the things we don't always think about with Social Security is that a lot of the recipients are kids who've lost a parent and people who are disabled, so it really does affect people who are young. And also, it's a program that all of us are hoping to retire someday and collect retirement money from. And so this cut that is being proposed and is on the table is something that could affect you. Basically, what the change CPI is a different way of calculating the COLA, the cost of living adjustment that happens most years in lots of federal programs, and at your work you hope to get a COLA each year, which is a little raise to go along with inflation so that your salary or your benefit package keeps up. What we normally do is calculate the CPI, which is the Consumer Price Index, and figure this is about how much you have to pay for stuff you want, and it's going up, so here's the increase you're going to get. What the chain CPI does is assume, well, prices are going up, but maybe if the price goes up on matzah, you'll buy a different brand of matzah. If the price goes up on these kinds of bags, you'll buy a different kind of bag. If the price goes up on trips, you'll do some other kind of leisure activity. So it decides that the prices may go up on some things, but inflation really isn't that high because you can always swap stuff out. Well, if we did that for things like for Social Security benefits, it doesn't really make as much sense because Social Security beneficiaries tend to spend a lot of their money on health care. When you need health care, you can't swap it out. So that's one of the reasons we've been looking really hard at the change CPI. It would be a cut in benefits, and it doesn't really make a lot of sense for seniors because they can't really do what that change CPI is suggesting they do. So that's one of the pieces in the budget that we're looking really closely at. There are also things we're looking at really closely with Medicare. There are a lot of different ideas. One was increasing the age at which you collect Medicare, which sounds like a good idea because people are living longer. But what happens is you end up with people between 65 and 67 who are uninsured, which saves the government money initially, but those people end up applying for Medicaid, and that costs the government more money on that end, or it ends up costing employers more money because they end up covering those people longer while they work. And so in the end, you may save the government a little money, but the whole healthcare system doesn't save any money. And we want to look for ways to save Medicare money, but to save the whole healthcare system money. So we're looking in the budget for ways to cut Medicare spending, but in doing that, we want to save money for the entire system, not just cost shift it to somebody else.